Many of you will know that health in Africa lags behind in many of the areas of diseases, still have very high mortality and morbidity in Africa. This is coupled with the challenges of the populations of Africa not being able to afford care or to access care, and the access could be limited by many things, could be limited by the context in which they live, could be limited by financial affordability, could be limited by culture, distances. All these things contribute jointly onto the mortality and morbidity of in health that we see in Africa. Though we have made significant gains during the MDGs, there is need to move towards a more sustainable health system building in Africa. And this need arises more specifically for Africa because of the context. Even if you provided the health system, the demand may be a challenge because of literacy, because of culture. And even if you resolved the demand side, you need a strong health system. So there are all these things that interplay that are very specific to the context of the African continent. We are aware that governments have taken many commitments towards universal health coverage, but we find as an organization and also working with many other partners that there's a challenge in converting these commitments into action. And we ask why. Many of the answers lie in the context. Many of the answers lie not in the technical side, but they lie in the more difficult side of changing the context, the culture, the affordability, the fiscal space. There are all these other issues. And also how to create multi-sector partnerships like private sector, education, climate change, health, that would all work together in an orchestra to achieve universal health coverage for the African countries. As Arm of Health Africa, we came up with a platform that specifically looks at the Africa Health Agenda and discusses Africa's context, Africa's research, Africa's challenges, Africa's problems, and Africa's solutions in an African context to move the African countries towards UHC. So in March 2019, we are holding the next Africa Health Agenda in Kigali, and we welcome you to come and discuss the issues around universal health coverage that have to do with access, that have to do with financing, that have to do with quality, that have to do with accountability, and that have to do with the health system issues. So it's going to be an exciting time. We expect that we are going to have more than 1,500 guests at this conference. It is in partnership with the Ministry of Health in the Republic of Rwanda and with the support of WHO and many other partners. We have key partners who've already come on board and that we have signed up. And if you go to our website, and that is ahaic or ahaic.org, you'll find all the partners listed there, and we are still signing up more. And you will find a link at which you can register to participate. You can also find a link on how to support the conference. But we look forward to hosting you in Kigali in March 2019 to one of its kind African platform to discuss African problems and African solutions towards universal health coverage. We hope to see you there.